Hi, and welcome to the second part on the chapter on consciousness. We have explored sleep, a necessary, involuntary, altered state. I say involuntary because I've taught in class before and I've seen students just fall asleep. I don't think they voluntarily came to class to fall asleep. It's involuntary. This week we're going to look at a few voluntary forms of altered states. Meditation, which involves concentration. Hypnosis, which involves suggestibility. And psychoactive drugs, which involves choice. So let's begin part 2. Meditation is a practice of focusing attention either on an object, word, or even your own breathing. Not all meditations are sitting or lying down. There are walking and other moving techniques. This aims to block out all distractions and to attain an alternative state of consciousness. Now, meditation has been supported by psychological changes, things like heart rate, blood pressure, and with brain imaging shows brain activity levels change during meditation. So some of the meditation techniques, there's a variety of things you can do, but you'll find in your textbook on page 103 a try it. Find a quiet place and sit in a comfortable position and try the technique. Hypnosis is a technique that uses focusing of attention, suggestibility, and a lowered response to external stimuli. In a hypnotic state, a distorted perception can be gained, giving rise to perhaps seeing, feeling, or even tasting things that are not there. Now, most people can be hypnotized to some extent. Hypnosis is used in medicine, dentistry, psychotherapy, and it's been used successfully in the control of pain. When I was in university, I did a major paper on hypnosis, and I had an opportunity to meet a dentist out of Kitchener, and he used hypnosis in his dentistry practice. Those who had a high degree of suggestibility, or even a middle-of-the-road degree, he could hypnotize by putting a clothespin on an earlobe and hypnotize the person that as long as that was there, that clothespin was on the ear, they could feel no discomfort. Surprisingly, he could drill into people's teeth with a clothespin on the patient's ear. The role of hypnosis is an altered state that can work in some respects like a drug can. Speaking of drugs, let's go into psychoactive drugs. Now, these are any substances that alter mood, perceptions, or thoughts. There are two terms to get to understand, to perhaps better understand the issue of altered states involving the consumptions of drugs. There's one, it's known as physical drug dependence. And it's is the compulsive pattern of drug use in which the user develops a drug tolerance. So the physical drug dependence is that it becomes something that you are compulsively searching for. You can develop a drug tolerance, that is to say, the more of the drug you do, the more you need that drug to get a similar high or similar effect. So drug tolerance, the larger and larger doses are needed to get the same effect. And then there's withdrawal symptoms, which appear when the drug is discontinued and disappear again when the drug is taken. And certainly for different drugs, they have different withdrawal effects. Psychological drug dependency. Now, this is probably the part of drug dependency that can be the most difficult. Psychological drug dependency is the craving, an irresistible urge for the drug's positive effects, and this is often more difficult over the long haul than physical dependency. Psychological dependencies can come back to you quickly. So, for example, let's say you've given up drugs and alcohol, and you go back to the same neighborhood as you've always been. And this physiologically, the need for that drug can disappear in a month, to 45 days. But the psychological, I go back to my neighborhood, I see the old bar, I see my old friends, that can draw me back into my drug or alcohol use. That's the psychological dependency. Now, there are 4 factors that influence addictive potential of drugs. One is how quickly the effects of drug are felt. 2, how pleasurable of the drug's effects are. 3, how long the pleasurable effects last. And 4, how much discomfort is experienced when the drug is discontinued. So we're going to look at the major categories of psychoactive drugs: stimulants, depressants, and hallucinogens. We'll start with stimulants. Stimulants speed up activity in the central nervous system. It suppresses appetite and makes a person feel more awake, alert, energetic. Common stimulants, and we'll quickly review: caffeine, nicotine, amphetamines, cocaine. Caffeine, I'm a major user. The world's most widely used drug, makes us more mentally alert and can help us stay awake. Nicotine is a highly addictive stimulant, as tolerance develops within hours. So even when you start to develop the tolerance for it, that more is needed to get the same effect. Amphetamines increase arousal, relieve fatigue, and suppress the appetite. With continued use, they result in exhaustion, depression, and agitation. Cocaine causes the feeling of euphoria, is highly addictive. Heavy use can cause heart damage, seizures, and even heart attacks. Hallucinogens alter perception and mood and cause hallucinations. Now, LSD is a powerful hallucinogen with unpredictable effects ranging from perceptual changes to vivid hallucinations to states of panic and terror. A drug you might be familiar with is Ecstasy, and it's a cross between a hallucinogen and an amphetamine, and it can cause the feeling of relatedness and connectedness with others, and it causes, unfortunately or fortunately, however you choose to view it, can cause damage to serotonin level neurons, and that becomes important in terms of other issues that we might have to deal with. Now, marijuana produces a feeling of well-being, relaxation, and lowered inhibitions from an anxiety. The user may experience giddiness, increased sensitivity or sensory stimuli, and perceptual distortions and hallucinations, such as the slowing of time. Marijuana has been used to treat glaucoma and to control nausea and stimulate appetite in patients receiving chemotherapy. There is some evidence that heavy marijuana use can cause memory problems, respiratory damage, loss of motivation, impotence, lower testosterone levels and sperm count, irregular menstruation cycles, and lower birth weight babies. Now, the last group is that of depressants, and as the name would suggest, compared to stimulants, depressants decrease activity in the central nervous system. They slow our bodily functions down, reduce sensitivity to outside stimulation. Depressants include sedative hypnotics like alcohol, barbiturates, and minor tranquilizers, and narcotics like opiates. Alcohol decreases anxiety and inhibitions at the low amounts. Higher amounts of alcohol can lead to symptoms of drunkenness, such as slurred speech, impaired judgment, and poor coordination. Too much alcohol can cause a person to lose consciousness and, unfortunately, can die. I lost 2 friends to alcohol poisoning back in high school. So it does happen. It's not common, fortunately. Barbiturates act as sleeping pills. Excessive use can lead to memory impairments. Alcohol and barbiturates, taken together, can be fatal. Narcotics, which include opium, codeine, morphine, and heroin, have both pain-relieving and calming effects. Opium is the earliest form of this drug. Morphine is a more refined version of opium, but it's highly addictive. Heroin was believed to be a pure form of morphine and therefore is less addictive, but is in fact even more powerfully addictive. Methadone has the ability to control the symptoms of heroin or morphine withdrawal without the euphoria, or the high, if you will, of heroin and morphine. Now, that's a pretty quick overview. I appreciate that. However, you'll find more of that information in your textbook. And I hope this has been helpful for you. Good luck, keep up the good work, and we'll see you next week in videos. Bye now.